Falls Risk Assessment and Nursing Care Plan Part 1. A fall is defined as an event that results in a person coming to rest inadvertently on the ground or floor or other lower level. WHO, 2021. Falls put a person at risk for a serious injury and reduce their ability to remain independent. According to the Center for Disease Control and Prevention, CDC, falls are the leading cause of death among adults 65 and older, causing over 34,000 deaths for that age group. Falling is the second leading cause of death from unintentional injuries globally. Death from falls is a serious and endemic problem among older people. It is estimated that fall death rates in the U.S. have increased 30% from 2007 to 2016. If this rate continues, the CDC anticipates 7 fall deaths every hour by 2030. Injuries from falls are costly and cause prolonged hospitalization for the elderly. In 2015, the total medical costs for falls totaled more than $50 billion, and over 3 million emergency room visits. Additionally, the quality of life after sustaining falls is significantly changed. Falls are the most common cause of traumatic brain injuries, TBI, and most hip fractures are caused by falling. Each year, over 800,000 patients are hospitalized because of falls. Nurses play a major role in preventing falls for their patients through education, evaluating fall risk, creating safer environments, and providing interventions in preventing injuries from falls. Risk factors may include: several factors and conditions contribute to patients' risk for falls, including the following. Adults. 1. Age 65 years and older, lower limb prosthesis, use of assistive devices such as walker, crane, and wheelchair, living alone. Children. 1. Less than 2 years of age, inadequate supervision of infants, toddlers, and preschoolers, insufficient safety guards on windows and heights. Lifestyle. 1. Unsafe workplaces such as buildings, bridges, insufficient safety equipment to protect workers from falls. Physiological. 1. Lower body weakness, vision problems, hearing impairment, foot condition, balance difficulty, postoperative patients, use of assistive devices for mobility. Emotional state. 1. Stressful situations can lessen a person's ability to concentrate, depression. Environmental. 1. Environmental hazards such as clutter and throw rugs, insufficient lighting, broken or uneven steps that can cause tripping, unprotected creeks and landfills, unsecured swimming pools. Cognitive. 1. Impaired levels of alertness, alteration in cognitive abilities and functioning, lack of sleep, unconscious or semi-conscious, disoriented and confused patients. Pharmaceutical agents. 1. Polypharmacy, tranquilizers, narcotics, hypnotics, sedatives or antidepressants, over-the-counter medicines that can affect balance and gait. Desired outcomes. The individual will relate controlled falls or no falls, as evidenced by the following indicators. 1. Patient will not sustain a fall. 2. Patient will relate the intent to use safety measures to prevent falls. 3. Patient will demonstrate selective prevention measures. 4. Patient and caregivers will implement strategies to increase safety and prevent falls in the home. Nursing assessment and rationales. Falls are due to several factors, and a holistic approach to the individual and environment is important. Suppose a person is considered at high risk for falls after the screening. In that case, a health professional should conduct a fall risk assessment to obtain a more detailed analysis of the individual's risk of falling. A fall risk assessment requires using a validated tool that researchers have examined to be useful in naming the causes of falls in an individual. As a person's health and circumstances change, reassessment is required. 1. Assess for circumstances associated with increasing the level of fall risk upon admission, following any alteration in the patient's physical condition or cognitive status, whenever a fall happens, systematically during a hospital stay, or at defined times in long-term care settings. The degree of fall risk can be determined using the assessment of intrinsic and extrinsic factors. Standard assessment tools can also be used, discussed below. The nurse should consider these factors when planning care for patients with fall risk. 1.1. Assess history of falls. Individuals are more likely to fall again if they have sustained one or more falls in the past 6 months. The elderly population is at increased risk of fall-related readmissions based on a study identifying the factors predictive of repeat falls-associated outcomes, Prabhakaran et al., 2020. 1.2. Assess mental status changes. Persons with impaired awareness and disorientation may not understand where they are or what to do to help themselves. They may wander from one place to another that may jeopardize their safety. Additionally, confusion and impaired judgment increase the patient's chance of falling. 1.3. Assess age-related physical changes. The ability of people to protect themselves from falls is affected by such factors as age and development. Older people with weak muscles are more likely to fall than those who maintain muscle strength, flexibility, and endurance. These changes include reduced visual function, impaired color perception, change in center of gravity, unsteady gait, decreased muscle strength, decreased endurance, altered depth perception, and delayed response and reaction times. In older adults with age-related macular degeneration, increased visual impairment was particularly associated with an increased incidence of falls and other injuries. Less contrast sensitivity was quite associated with both increased rates of falls and other injuries, while decreased visual acuity was only associated with increased fall rate, Wood et al., 2011. 1.4. Assess the patient for sensory deficits. Sensory perception of environmental stimuli is paramount to safety. Vision and hearing impairment limit the patient's ability to perceive hazards in the surroundings. The elderly who lived in homes with dimly lit kitchens and clutters at entryways or backyards were found to be at a considerably greater risk for falls, Huang, 2004. 1.5. Assess the patient's balance and gait. Older adults who have poor balance or difficulty walking are more likely to fall. These problems may be associated with lack of exercise or a neurological cause, arthritis, or other medical conditions and treatments. An important risk factor highlighted in a study is that adults with rheumatoid arthritis are at high risk of falls, including swollen and tender lower extremity joints, fatigue, and use of psychotropic medications, Stanmore et al., 2013. 1.6. Assess the use of mobility assistive devices. Inappropriate use, improper selection, and maintenance of mobility aids such as canes, walkers, and wheelchairs can increase energy expenditure, unsteady gait, overload, and joint damage and ultimately increase the patient's risk for falls. Older adults who are frail and are not using ambulatory assistive devices fall more during their activities of daily living, Cruz et al., 2020. Education programs should be developed to encourage proper use of ambulatory assistive devices by the frail elderly. 1.7. Assess for disease-related symptoms. Increased incidence of falls has been demonstrated in people with symptoms such as orthostatic hypotension, reduced cerebral blood flow, impaired urinary elimination, edema, dizziness, weakness, fatigue, and confusion. Patients with certain diagnoses experience more falls than others. For example, patients with stroke were more likely to fall than other patients, thereby lengthening their stay and increasing their medical costs during physical rehabilitation, Shalamon et al., 2012. Patients with orthostatic hypotension whose blood pressure drops upon often standing experience lightheadedness or dizziness that can cause falls. 1.8. Review the patient's medications. Risk factors for falls also include medication use such as antihypertensive agents, ACE inhibitors, diuretics, tricyclic antidepressants, alcohol use, anti-anxiety agents, opiates, and hypnotics or tranquilizers. Older adults usually take various medications for multiple chronic conditions. Hospitalized older people taking medications are increased risk for falls based on a study on the association between drug use and falls, Ralimi and Jacker, 2009. Drugs that affect BP and level of consciousness are associated with the highest fall risk. Medications causing high risk for falls. Point value, risk level. Medication class. Fall risks. 3. High. Antipsychotics, anticonvulsants, and benzodiazepines. Sedation, dizziness, postural disturbances, altered gait and balance, and impaired cognition. 2. Medium. Antihypertensives, cardiac drugs, antiarrhythmics, and antidepressants. Induced orthostasis, impaired cerebral perfusion, and poor health status. 1. Low. Diuretics. Increased ambulation and induced orthostasis. If score is greater than 6, there is an elevated risk for falls. Evaluation of medications for possible medications to reduce risk for falls is necessary. 1.9. Assess for unsafe clothing. Clothing and shoes that are poor fitting or overly tight can restrict the person's movement and ambulation, contributing to fall risk. 1.10. Evaluate the patient's environment. A fall is more likely to be experienced by an individual if the surroundings are unfamiliar, such as furniture and equipment placement in a certain area. Environmental hazards contribute to falls to a greater extent in older healthy people than in older frail people due to increased exposure to fall hazards, with an increase in the proportion of such falls occurring outside the home. Lord et al., 2006. CDC checklist on how to find and fix hazards in homes. The nurse may need to assess the environment of the home, workplace, or community. In the home, clutter, throw rugs, light insufficiency, broken or uneven steps can cause tripping. Poor lighting, being in an unfamiliar environment, wet floors or surfaces, clutter, slippery floors, and obstacles on the floor all increase the patient's fall risk. Workplaces that require stairs may also create occupational hazards in the workplace. In the community, inadequate street lighting or unprotected creeks and landfills may also cause accidents. 2. Assess patients' fall risk using Fall Risk Assessment Tool, FRAT. Falls Risk Assessment Tool, FRAT, is a 4-item falls risk screening tool for subacute and residential care. The FRAT has 3 sections: fall risk status, risk factor checklist, and action plan. 1. Part 1, Fall Risk Status. 1. A fall risk status includes data about history of recent falls, medications, psychological and cognitive status of the patient. 2. Part 2, Risk Factor Checklist. 2. A risk factor checklist includes vision, mobility, transfers, behaviors, activities of daily living, ADLs, environment, nutrition, continence, and others. 3. Part 3, Action Plan. 3. An action plan involves clinical judgment and expertise when selecting core interventions to protect patients from falling, including individualized plans of care based on actual fall and injury risk factors. 3. Assess the patient's fall risk using the Hendrick 2 Fall Risk Model, HIFRM. The Hendrick 2 Fall Risk Model determines risk for falling based on gender, mental and emotional status, symptoms of dizziness, and known categories of medications increasing risk. Each fall risk factor has assigned risk points set upon the study findings. If the patient scores on a risk factor, the corresponding number of points are counted to the patient's fall risk score in the box to the far right. If a patient's fall risk score totals 5 or higher, the person is at high risk for falls. If the patient scores only 4 points or lower, they are still at some risk of falling, and the nurse should use their best clinical assessment to manage all fall risk factors as part of a holistic care plan. 4. For pediatric clients, assess sensory or motor deficits, recent illnesses, unsteady balance, running at speeds beyond capability, and inadequate supervision. Assessment factors will assist in identifying appropriate interventions.